We are an international fertility clinic in Spain. We are based in Madrid and Alicante, and we are what we called a boutique clinic. We are a full team of very international professionals. That's why we have many international patients, which also means many complex cases, because most of our patients already come with 4 to 5 previous fertility treatment before they start with us. Well, what we do and why we are working with Redia is because all our treatments, IVF and egg donation treatments, have some guarantees, and that's why Dr. Kavakas is with us today. And I'll let him explain to you how our guarantee programs works.
Let me explain first of all what is Redia IVF. Redia IVF is an international provider of refund guarantee plans for fertility treatment. So basically, patients as you who watch this webinar and consider a fertility treatment, you have the option of going to the clinic directly and do a cycle of IVF, taking your risk whether that will be successful or not. As we all know, the success in IVF is unpredictable. So there is a chance to success, and obviously the factors that influence success rates are many, and it's not the time now to analyze this, but you have a percentage chances of success and a percentage not to succeed. So this journey, the fertility journey, and some of you may have faced 1 or 2 failed cycles already. So you have been, and you understand what I'm talking about. So this is a psychological burden on the fertility patient. So what we do, we come and we guarantee. We cannot not guarantee the baby, of course. We're not God, but what we say is that we guarantee a refund just in case it doesn't work. That takes out all the psychological burden and financial burden from you, and you concentrate on the treatment with the clinic. So we partner with fertility clinics worldwide in different countries and different cities, and obviously Spain is our main international outside the UK. I mean, we are a UK company, but our main country of operation is Spain, as Spain is one of the most important IVF destinations. So we have patients from many different countries. UK obviously is a hub because we are based in the UK. However, we have patients from different European countries, north and south, east and west, and also from outside Europe, such as the US. So a significant number of them, the biggest percentage, go to Spain, as Spain is one of the most advanced fertility countries where fertility treatment is provided. And we work obviously with some of the best clinics available. One of those is Vida Fertility, and we're happy to have this talk today. And the reason we work with the best clinics is that we take all the risk of failure upon us. So we want to make sure that the clinics that we work with are actually providing good results. So how the plan is structured? IVF packaged that we offer, we package them in 2 or 3 cycle programs. It's a cycle. When we talk about cycle, we talk about stimulation cycle. So that includes all the frozen embryo transfers. For example, in one stimulation cycle, we may have a number of embryos developed, and is considered the end of the cycle, is not considered just the end of the first transfer. But after transferring all the develop embryos. If the first is not successful, we do transfer, we do frozen transfers of the remaining embryos, and when all embryos are transferred, then we consider the cycle complete. So the package includes 2 or 3 cycles of those. All the stimulation costs are included, and all the embryo transfers as well as the freezing cost of those embryos are included in a program. A refund guarantee varies from 50 up to 100%. It can be 50, it can be 70, it can be 100. And that percentage depends. We agree on that percentage with you in the beginning of the program. When you start, we signed a contract, so you know what is your refund guarantee percentage. That means that you may opt out to have a 50% because of a lower cost, or we may only offer you a 50% because of medical eligibility. I'm going to talk about medical eligibility in a moment, but what I'm saying is that not everybody can. You have to meet some medical eligibility minimum to be eligible for 100%, but you can still be eligible for a 70 or a 50 with lower medical eligibility criteria. In IVF with own eggs, we accept patients whose female age is up to 39, included 39, younger than 40, basically, and that includes, as I said, up to 3 stimulation cycles, ICSI included, unlimited frozen embryo transfers depending on how many embryos are in the cycle monitoring, the egg retrieval, the blastocyst culture, which is 5 days of development of the embryo freezing, if there are embryos to freeze, if we have more than 1 or 2 embryos that are transferred in the first transfer and we have excess embryos, we freeze them, and up to 1 year of storage we cover with the package. Egg donation IVF for female patients up to 50 years of age. Again, all of the above that we mentioned are included, plus donor medication. So medication that the clinic is using for the donor stimulation is also included. We have a program called Hybrid IVF that is for patients up to 45. This is a unique program. This is for women that have premature ovarian failure or low quality of eggs, and but it's not 100% sure that they will need egg donation. So we give them a last resort, last chance for them to use their own eggs, but with the medical criteria that we use for egg donation. So most of the patients that have very low AMH or low antral-follicle count can still enter hybrid IVF, doing 1 cycle with their own eggs, even though they are not meeting the criteria for the own egg IVF refund guarantee program. And the age also is higher, so up to 45 years of age can be accepted in this program. However, there is a requirement that if the first stimulation cycle with own eggs fails, all the transfers in this cycle fails, then we have to go to egg donation in the second or third cycle. So all the expenses that are included in an IVF program are included in the first cycle, and all of the expenses that are included in an egg donation program are included in the second or third cycle of the program. And hybrid may have up to 100% refund guarantee. And finally, embryo adoption. This is a unique program that Redia IVF is offering, using adopted embryo, frozen embryos, for female patients up to 50. And this includes up to 3 embryo adoption cycles, depend on what the clinic offers. In some clinics, I'm not sure about, Karine, you may enlighten us here, whether Vida is doing only single embryo transfers, or you can also transfer 2 embryos at a time. So if the clinic offers embryo adoption with 2 embryos at a time, we offer that. If they do single embryo transfers, we offer 1. So it's the embryo adoption transfer that the clinic is offering. Up to 3 cycles of that is included in the embryo adoption program. What is not included in the programs? Screening tests for medical eligibility and studies. So before you get accepted in the program, you have to do some screening tests, some basic medical eligibility. If you have already done them, they're recent, like in the last 6 months, we may accept them. So you may not need to redo them. If you don't, you have to go to one of the Vida fertility clinics and do the test. And these are not included in our price. If you want to use, or if the doctor recommends to use PGTA or any other additional lab methods other than blastocyst culture and ICSI that we include, and I think we do include assisted hatching in our programs with Vida, but any additional method that you may need, or if you do PGTA, you can pay directly to the clinic as an extra cost. If anyone uses sperm donation, this is not included. You can still do it, but you can cover the sperm donor cost. If you traveling from abroad and you have to do any blood tests and scans during the monitoring of the cycle, we said that these are included if they're done in Vida in-house. But if you choose to do them in your home country, if in the UK or in Germany, I don't know where you're watching us from, but if you want to do it in there, you have to pay for that. These are not refunded. And obviously the medication costs are not included, apart from the donor medication in donation programs that I mentioned before. I mentioned in the beginning about the financial peace of mind. This is the first and most important reason. First of all, it gives you a psychological relaxation, because every fertility patient has a psychological burden, because it's not easy to face infertility and to try to overcome it, to reach your goal, to reach your dream, to have a baby. And if you add to that the frustration of a financial cost, whether you spend your money without knowing if you have a result, then it gets really frustrating. So at least what we can do is we can remove that financial burden from you, so you know how much it will cost you to have a baby, and you have no stress of the uncertainty, because you know that just in case you don't reach your goal and have a baby, you will get your money back. So at least you can concentrate on the medical treatment with the clinic and get rid of the financial burden. It's a refund guarantee. You know that you either having a baby or your money back. And also you do savings. For example, on average, one need at least 2 cycles of IVF to achieve success. So if you calculate all the costs, and if you see how much a refund guarantee program costs, you can make significant savings if you don't succeed early enough. Obviously, there are some who will succeed in the first cycle and they would have paid more, but at least their stress are released because they have the baby. However, the majority of patients do not succeed first time. And since you do not know, since there is uncertainty of the outcome, And these programs offer you, as I said, the peace of mind that you can concentrate only on medical treatment without thinking of finances. Can I change my mind and withdraw? Yes, you can change your mind and withdraw at any time during the refund program, provided that there is no ongoing pregnancy. Obviously, if you are pregnant, you cannot withdraw from the program until you give birth. And when you give birth, you withdraw from the program and you don't get any refund. The only way to get a refund, a full refund according to the program, is either to complete all the cycles, either 3 or 2, and all the transfers without having any success, and then you are eligible to get a refund. However, if you withdraw with that before the end of the program, you may still be eligible for a refund. So what we do, we'll calculate all the expenses. For example, you have done 1 full cycle and 2 frozen transfers, but for any reason, maybe something changed in your life, maybe you have other priorities and you want to stop the program, you have the right to do so. We just calculate how much we have paid, how much were your costs that far. We deduct that from the amount you paid, and we refund you the remaining balance. So that's you are sure that in case you want to withdraw earlier, you don't lose anything. You just have paid for every services you received. Prices depend on the specific treatment and the chosen refund percentages. If you are interested, you can contact either Vida Fertility directly, or you can contact us at info@redia-ivf.com. You will see the contact at the end of this webinar, and you can see the specific. We can give you the specific prices depending on your age, on the treatment that you need, whether it's own egg IVF, whether it's egg donation, whether it's hybrid, as I mentioned before, and the refund percentage. The refund percentage will tell you the different prices of the refund percentages. If you are accepted for all of them, you can choose the percentage that you would like to enroll in. But it may be the case that some of you may not be accepted for 100%, but only for a 50 or a 70. But we will let you know. This will be done after the medical screening, after you complete all the tests needed, and we make a judgment on your eligibility, which is done fairly quickly. If we have all the tests within a couple of days, we'll give you a ruling. Obviously, if we have to wait for a test, that can be a more lengthy process. So you can ask any of our patient advisors. If you contact us, our patient advisors, one of our patient advisors will get in touch with you, or you can ask the clinic and give you some information and refer you to our patient advisors. You can finance your IVF refund plan on your own through a personal loan that you can arrange yourself. Depending on your location, we may be able to assist you with financial options. We are looking at partnering with financial institutions in the UK. If you are a UK resident, we have financial options if you're a Spanish resident, and we're looking for other options in some specific other European countries. So get in touch with us, and we will work with you and tell you what is available and what is not. So a patient advisor will invite you to join a patient platform. We have a CRM, a patient platform. Once you get in touch with us, we will send you a consent form by DocuSign, so you can digitally sign. That will give us your consent to exchange information with the clinic, because we will need medical data, medical tests that you've done at the clinic. So, and also we have to provide the clinic with your information if you come directly to us. So we need a consent form for this kind of exchange of data between us and the clinic and yourself. Once this is done, you join the patient platform, and you can upload any, or the clinic can upload any medical test that we will study for your eligibility. As I said, if those tests have been done recently, you can upload them yourself, and we can consider them. If not, you can go to the clinic and do the test, and the clinic can upload them to your profile on our platform. Once uploaded, our medical advisor will assess them and make a decision, and will give you your options for all or some of the percentages that I told you before. Following your eligibility, you can sign our contract again digitally via DocuSign, and pay for the program. Once paid, the clinic will be informed, and you can start your treatment. Everything else, what is included in the program financially, will be between us and the clinic. We have our own agreement, so you don't have to pay anything that is included to the clinic. You only pay for extras that are not included. And these are the contacts details for you if you would like to make a screenshot of that, or make a photograph. But this webinar will be available at the Vida Fertility channels, and also Redia channels as well. This is the email that you can email, info@redia-ivf.com. There is a UK phone number to call for those who would like to call, or a WhatsApp number to text. This is for messages only. If you're living outside the UK and you cannot call internationally, but you can send a WhatsApp message, we will reply to that message. And also you can see the clinic's email and phone number there.
Yes, don't hesitate to contact us also to have like a first consultation with the doctor, so you know what to expect in terms of diagnosis also, before you can, see your financial options with Redia. Here are our social media and website. We invite you to follow us and, see where, for instance, for Vida, meet the team, and for Redia to understand also about the package they are doing. Right, Dimitris?
Yes. Yes, all the information is on the website, and we post regularly on Instagram and Facebook, and you can find us on LinkedIn as well. So get in touch with us, get in touch with the clinic, and we will take care of you.
Yeah, we will help you through. Don't worry. Thank you so much, Dimitris, for your explanation. It was very clear, and I hope it will help all the patients interested.